Hi, hello everybody. I hope that everyone can hear me clearly. So welcome back everyone. Good evening, and we've been such a long time since we've last do live. From my record, I was checking earlier today, right? I was checking that our last webinar was actually 3 months ago. And today we are coming back again, coming back strong. Hopefully that we are able to do it more constantly, more opportunities for us to do it together so that we can share more information on mental health in the cancer context. If for those who are still new, I'm Jefferson. I'm the clinical psychologist from National Cancer Society of Malaysia, Kuala Lumpur. And for those who have actually joined our webinar previously, well, hi again. I'm back. And unfortunately, very sad today, Guy is not able to join us today. However, we have a good opportunity, a privilege actually, to invite one of my best friend from my university days, from my master's studies. She will be joining us today to share on her views of of her knowledge about cancer as well, because she has been dealing a lot with cancer patients and cancer caregivers, and I feel that she's able to bring more knowledge to the plate, in our webinar today. So without further ado, let's just welcome Umu Nasra, my best friend, the beautiful Umu.
Hello. Hi,
Right, hi
Jefferson.
Umu. Right. Thank you for joining in today.
Thank you
Right,
for having me.
thank you for taking up the time. I know you have a very busy schedule, and today, thank you for joining us. And Umu is actually representing KBJ Ampang Putri Specialist Hospital. So maybe
Correct?
Umu, since you are the very first time joining us in our webinar, maybe you can share with our audience today some brief background of yours, and you can share where you're from, what you're doing now, and how. Just a brief background lah.
Sure. That will be that. Thank you so much for the introduction. Yes, I have known Jefferson for quite some time already, and it is actually a privilege to be invited to be talking about cancer as well as the caregiver. So, just a brief introduction. My name is Umu Nazra Nazam. I am currently a clinical psychologist in KPJ Ampang Putri Specialist Hospital. So I did my bachelor's degree in psychology from International Islamic University Malaysia, and then I continued my master's studies at UKM under clinical psychology. So also a brief background, I have been trained in both the hospital, National Hospital, Hospital Awam, as well as private sector to just provide care for patients as well as caregivers. I
Right.
guess, is
So
that enough?
yeah. I mean, that's more than enough, I would say. Knowing
Thank
that
you.
you have so much, of clinical background. So we hope that today you are able to bring more to our webinar today. And yeah, the reason why I actually invited Umu is that she actually did a webinar previously during Pink October month, and that's where
Yeah.
I found okay, Umu has the capability, or she's good in front of camera. So there you go, here she is.
No, okay, thank you. I
Right.
hope
Okay.
so.
Hope that I don't give you more pressure, Umu. Right. Okay. So right. So just another introduction. Like today, our webinar is going to be some little bit different. Unlike previously, we are just going to do presentation and you will just read from the slide. So today is going to be like a talk show thing. So there's more of like sharing conversations between me and Umu, and
Yeah.
slides. We still have some slides, but it's just for guidance. But mostly we'll be on talking. Right. Okay. So without further ado, let's move on to our webinar today. So with the
Okay.
title, "The Shadow of Cancer, Understanding and Overcoming Fear." Right. So Umu, I think we have both encountered a lot of clients coming in sharing with us that they are facing a lot of fears, especially getting diagnosed with cancer or even they've completed cancer treatment. So fear is actually a significant aspects
It
in a
is.
cancer patient's life, not just cancer patients, right? Among caregivers as well.
Exactly. Yeah. I agree.
Right.
I
Yep.
agree. I think it's an unsolicited fear. I mean, when you get newly diagnosed, even if it's just not for cancer, if it's just for maybe like a viral fever or whatnot, something that is you don't actually expect things to happen, and then it suddenly comes to you. I think it's just normal. It's understandable to have fear, especially towards
Right.
something very very foreign, and especially towards something very novel. Yeah. So I
Yep.
agree.
So, the uncertainty of things actually can
Correct. The
contribute, can
uncertainty.
elicit the fear, right? Okay, so let's go on to our topics of discussion today. So we'll be discussing of four things today, relating to fear. Okay, so let's go in. So are you ready, Umo?
Ready when you are.
Right. Okay, so the very first thing is that why do people have fear? So Umo, maybe you can share, what's the reason behind fear? Do you think that there's a reason behind it? Like what
I
motivates people to feel fear?
I have multiple actually.
Hmm,
Why do
hmm,
people have
hmm,
fears?
hmm,
Fears, you know?
hmm,
Everyone has it, but what does it truly mean? And why do we have
hmm,
it? So, based on my experience where I have been dealing with a lot of cancer patients as well as cancer caregivers,
hmm,
I feel that fear is something that is normal but it
mm,
has its intensity and its magnitude. So you can
mm,
have fear. Maybe today your fear would be like around 30%, but
mm,
some trigger or an incident or situation can cause that fear to actually increase itself. So maybe it could go
mm,
up to like 70%. So
mm,
why do people have fear? The most ex- the most straightforward explanation, or the most easiest thing for us to understand, is fear is actually a survival response. Everyone has it,
mm,
and we need it to survive. We actually
mm,
need fear to actually live in this world.
mm,
And
mm,
without fear, then you wouldn't be like you wouldn't be as vigilant around things. You wouldn't be
mm,
as as careful around things without this fear.
mm,
So
mm,
having fear is actually a normal response, and it's actually something that helps you survive. Survival of the
mm,
fittest
mm.
kind of thing. So it helps you to survive.
Right.
Other than
Mm-mm.
that, I guess it's also a learned behavior. Actually, if you think about it,
Mm,
it's like when you're a baby, you're like a blank slate. So
mm,
there are theories that says that, okay, you only learn fear based on the things that you have seen. So it's
mm,
something that you learn from maybe your parents, or maybe your caregiver, or maybe your
mm,
guardian. So if you
mm,
see someone like maybe being scared of something, which you don't
mm,
actually, you're not actually predisposed to that fear, but you see
mm,
someone
mm,
who's actually like takut kat benda tu, then you
mm,
will
mm.
eventually get that sort of fear as well.
Right, right. So it's like
Yeah.
those inborn people, when people they are young, they'll be fearful of, let's say, cockroaches.
Yeah.
Right. So maybe the child has never encountered something traumatic or something life threatening with a sad I mean, not a sad little cockroach. Sad cockroaches are not sad. I mean, a poor little cockroach, right? But they will
Yeah.
induce fear inside them. So there's like Umo have shared, right? It's a survival instinct.
Correct.
We may be born with that fear, or maybe we've learned it through experience, through
Correct.
exposure to these experiences
Yes.
that made
Yes.
us feel fearful.
Yes. So I believe that I think I've heard this theory about the cockroach. Have you
Mm.
heard of thyrophobia?
Tyrophobia.
The fear of small holes.
Ah, okay, okay.
Okay.
Mm,
So
mm,
I read this article where it says that the reason why some
mm,
people may develop thyrophobia, it's because
mm,
it's our genetic predisposition,
mm, mm,
where macam if you were to look at like a lot of leopards or
mm,
other wild animals, they have
mm, mm.
dots in their furs,
Right,
right?
right.
They have dots. So
Mm,
that dots gives a signal that, okay, this is danger. You're supposed to be
mm,
scared.
mm.
This is a threatening situation.
Right,
So
right.
because of that, it's our genetic predisposition to actually be scared of holes.
Mm, mm, mm.
Some
Especially
people
when
are
our ancestors, they are hunting or they are
correct.
living in the wild, so they are
Exactly.
exposed to all these
Yeah.
predators.
Yes,
Mm,
exactly. Because
mm, mm,
sometimes we just don't have you just don't have the answer. Why is it that we're super scared of little
mm,
tiny holes, and
mm,
you just don't
mm,
have an
mm,
answer for it? So
mm, mm.
the answer could be genetic predisposition.
Yep, yep. So again, to conclude, that fear is something normal. All
Mhm.
of us experience fear. It's just the intensity of it, and it changes along the way. It's like a continuum, lah, right? The fear continuum, right?
Correct.
During maybe this time we can feel fearful in this like intensity. Then from another trigger, it may triggers another next level of intensity as well.
Correct.
So
I
just
agree.
to yep, yeah. So just to emphasize again how what Umu have shared is that being fearful actually protects us from threats. So the threats like Umu have shared is like leopards, predators, or
Yeah.
even threats that can be life threatening. You can feel fearful. Your life is depending on it, or you feel that you may something bad may happen. So it all these things induces fear, and it's for actually survival purposes.
Yes.
Mm.
Yes.
Right,
Survival.
okay, so yep, and moving on to the purpose of fear, like we have been talking already, right? It's for survival. So it's
Yeah.
an instinctual response for survivorship. So like just now I just try to emphasize again how Umu has shared, right? If we don't fear something, we may be we if we are not fearful of something, we may be doing things that are risky for us.
Yeah.
So let's say if you are not afraid of snakes, we may just be curious and go and touch the
Yeah.
poisonous
Like
snake, right? The venomous snake,
exactly.
and we may die from it. Mm,
The repercussions of things. Exactly. It's like a
mm,
domino effect. You fear
mm,
things. It helps you prevent from harmful situation.
mm,
This being able to keep you safe. It's like
mm,
it's a domino. The domino
mm.
effect. Okay.
Yep. Right. So again, if we are not fearful of things, we may not live as long as expected. So actually, fear protects us. It stops us from doing things that may harm us, and it's also it's a stimuli with fight or flight, and we may get we may go into more deeper with this later on. And I think another purpose of fear is that it actually prepares us for some things that's gonna happen, like the future threats or future pain that people are gonna
Correct.
experience.
Yes.
Let's say you are afraid, you're always in this constant fear of snake. Although you may not see a snake in front of you, but you're always in fear of it. Why? Because it prepares you to when there's an actual snake in front of you, you know how you
Yes.
can respond to it.
And in a way, like you're actually training your body to actually,
Mm,
you're training your physiological response, you're training
mm,
your
mm,
psychological response to actually
mm,
be vigilant, or to actually
mm,
prepare
mm.
yourself from
Right.
this sort of danger. So it's not really just, physical preparation.
Mm,
It's not just
mm, mm,
like physiological preparation. You're also actually trying to prepare your emotional part of your well-being,
mm,
your
mm,
emotional aspect, your psychological aspect. So it works together. It works together as a
mm.
whole, I believe. Yeah.
Yep. So in this case, right, Omo, do you think that fear is the anticipation? It's a gift, or it can be a curse? Because if
Um,
we are fearful, we are preparing ourselves, so it may help us in the long run. But in some instances, I would say that when the phobia is so intense, it might be problematic, right? Maybe seeing a threat, they can feel that, oh, I'm seeing a snake, so they have this intense fear.
So they saying things. Are you saying like maybe they tend to like see things?
Mm, mm, mm,
Okay.
mm,
So
mm,
answering to your question, it could be a blessing or it could be a curse,
mm,
depending on the situation.
mm,
Because I believe, because one thing about fear is, like I said earlier, it has its intensity, and the intensity differs from one day to another, from one
mm, mm,
period to another. So
mm,
I
mm,
believe that it can be a curse,
mm,
especially when the intensity gets us at a very wrong timing. Meaning to
mm,
say that,
mm,
okay, you are going to present to your boss, or maybe you're going to present to your interviewer or whatnot. So
mm,
the fear actually drives you to like motivate you to do better, motivate you
mm,
to do
mm,
research, motivate you to practice in front of the mirror.
mm,
But that is a blessing, because that fear actually drives you to be better. It motivates you to
mm,
be better.
mm,
But it's a curse when you actually start to, when the fear actually starts to make you overthink, or
mm,
when the fear starts to make you think of things that are not true, or makes
mm,
you think of the things that are a bit irrational.
mm,
So
mm.
then I feel that that could be a curse.
Right,
So
right.
what we understand now is how, like, what could be the source of our fear,
Mm,
why we
mm,
have that kind of fear, and
mm,
what causes that fear to intensify. So that is something
mm.
that we have to be very vigilant over. We have to be
Right,
very
right,
vigilant
right.
of.
And coming back to the cancer context, right? If fear is a blessing in my, if the person is fearful of death, it may motivate a person to go for treatments, chemotherapy, although
Correct.
it can be distressing for them to go through those
Yeah.
treatments. But it can be a curse when the fear is so intense they actually avoid going to
Yeah.
treatment. Because
Avoid.
they're
Yes.
afraid of how this treatment is gonna do to me, do to
I
my
understand.
body. Am I gonna react positively towards this treatment? So it can be a curse if the fear intent is too much.
I agree. I agree. It hinders you from doing things that you know is best.
Right. Okay. So next, moving on. So what do you think are the fear responses? So we've been talking about fear, right? So do you think that there are different types of responses when it comes to fear, Umu?
I do. I
Mm,
believe there's four. That I believe there's
mm,
four different peer responses. But
mm,
but before you go to the next slide, I
mm.
want to give you a quiz. Would that be okay?
Oh no. Okay. This is what I feared the most, Umu.
It's good. It's okay. It's going to be a very very simple quiz.
Okay.
So let's say you are walking back to your car. You just
Mm,
you baru habis kerja. You're just walking back to
mm,
your car,
mm,
and then suddenly you came across this big wild dog. Okay, so it's
okay.
just staring at you, and you're staring at him back.
Mm.
How would you respond to that situation?
To be honest, if I saw a dog in the wild, my first reaction would be, "Oh my god, so cute! There's a dog."
Okay, but you
I
do,
would
but
actually
you
go
do,
to pet the dog.
but you do. You do hear you said that I did say it's a wild, dangerous dog, right?
Okay, so if the dog is, like growling at me, of course I will feel, I will freeze, to be honest. I'll just stand there
Okay.
and wait.
You will
I'll
just
just
stand
wait for
there.
the dog to go away itself before I make
Okay.
any move.
All
Mm,
right.
mm,
So
mm,
you would just stand there.
mm.
Like you be looking at the dog and the dog will be looking at you.
Yes.
Okay. Okay. All right. Someone in the comments said that I would play dead. Yeah, you would.
Okay,
I
that's
guess.
very similar.
I guess. Yeah, that is also very similar. That you would just like
Yep, yep, yep.
same thing. You look
If,
at
right,
him.
right, right, right.
The
If I
differences
die, the
is
dog wouldn't catch on me, right?
right, and like the differences is you would just be looking directly at the dog, and then
Mm,
I think Ehsan would just be looking, would just be shutting his eyes, her eyes, you know.
mm, mm,
So
mm,
that's
mm.
the two difference.
Right, right.
Okay.
Oh, you made it sound so romantic when you say look
Yeah,
into the
yeah.
dog's
You
eyes.
just look right directly into the dog's eyes. Okay. So the
Yep.
next scenario, last one, I
Okay.
promise. You're doing your work. You're doing your assignment. Okay, no, not assignment. You're doing your job. You're doing your
Mm,
task, and
mm,
suddenly your boss came to you
mm,
and he scolded you for things that you know is out
mm,
of your control,
mm,
but there's nothing you can do about it. But your boss kept on
mm,
scolding you. How would you
mm.
respond to that scenario?
Um. Right. I hope that my boss is not watching this video.
Okay, let's
Okay.
just change it
So
to your friend.
so right. Okay. So if going back to that scenario, right, if what will happen, I would most probably flee that situation first. I will walk out from that situation. Of course, I'll listen to what he said, and then I will walk out from that situation first for
Mm-hmm.
me to calm down, and also for my boss to calm down before
Mm-hmm.
we go back.
I
Of course,
see.
I will feel fearful. I'll be like, "What's happening? Did I did something wrong?" But my response will be, "I'll walk away first."
Mm-hmm. So
Mm, mm, mm,
basically you're trying to like lessen down, reduce the intensity of the situation, come
mm.
back whenever you're ready, all those things.
Yep, yep, yep.
Okay, all right. So I guess you can move on to the next slide now.
Right. Okay.
Okay, all right.
Okay. So
So
I think what Umu was trying to do just now was to briefly introduce what are the fear responses, right? And just now we have touched base on a few already, right? We touched base on freezing, like playing dead, standing there, not doing anything. Also flight, which is running away from the threat.
yeah.
Right. Okay. So maybe you can discuss about something the two other fear responses, Umu.
Right. So the two other responses would be
Mm,
something a bit more novel, a bit more new, because I
mm,
think everyone who learns biology in high school, they have heard of the flight or fight mode or the flight
mm,
or
mm.
response. But
Yep.
what about freeze and fawn? So freeze and fawn
Mm,
is actually something that you would tend to do, but you don't actually see it in our like you don't actually it's not actually shown in our naked eyes. So
mm,
freeze is actually when you are numb or when
mm,
you are unable to react
mm,
or you associate yourself from threat, meaning to say that you
mm,
freeze. You don't know, you're just numb. You can't move, you can't
mm.
talk, you can't
Right.
run, you just can't do anything. So
Mm,
for a good example is, I think everyone has watched a lot of like Indonesian dramas. So at the end of the Indonesian dramas, what they would do is they would just zoom in our face, and then zoom out, and then zoom into the antagonist's face, and then zoom out. So that's what
mm,
they do. All the Indonesian dramas do that at the end of every episode. So that is basically the most easiest example I could tell you for the freeze. So you just
mm,
tend to
mm,
freeze and you are unable
mm,
to say anything. So
mm,
I think
mm,
what Ihsan did say in the comment section below is that you froze. Your
mm,
fear response is actually you froze when you are in front of any threatening situation or
mm,
anything that caused you to be fearful. Okay,
mm,
so
mm,
and another one would be fawn. And fawn is a pleasing response when you are facing the threat. So you
mm,
compel or you try to please that particular person in order for you
mm,
to avoid any conflict. So,
mm,
for example, for the second scenario that I mentioned just now, when your boss got angry at you or you got scolded by a supervisor or whatnot,
mm,
instead of fighting your boss, or instead of flying away from the situation, or instead of you freezing, you actually try to go ke depan kan, you go to the threat, you go to the
mm,
perceived threat, and you try to please him, buy him
mm,
coffee, or
Mm.
like get him his laundry. Just
Mm.
do
Mm.
anything
Mm.
you can in order for you to please him.
Mm.
That and at the end of the day, you are able to avoid any conflict. So that is when
Mm.
you
Mm.
fun in order,
Right.
like,
Right.
yeah. So
Mm-mm.
fun
So
is basically trying to
yeah,
please
I
people.
think among all these four, right, fawn is the only response that will try to. It's a behavior that will try to reduce the threat level,
I agree.
right?
I agree.
Mm.
Fun is
Mm.
actually,
Mm.
it's good to actually
Mm.
fun, but also to a
Mm.
certain extent, because when you fun, you're actually facing the threat in a very
Mm.
rational manner. Meaning
Mm.
that
Mm. Mm.
macam you cakap tadi, like you would
Mm.
maybe like calm, like try to see whether the situation is a bit, like a bit relaxed. Then only you
Mm.
try to
Mm.
talk
Mm.
to your boss. I mean,
Right.
and when you fawn, sometimes there are certain particular situations where you just need to get this situation sorted. You just need to be
Mm.
like, you need the situation to like just be resolved. So what you do
Mm.
is you
Mm.
fawn without thinking, then that
Mm.
could be a problem. But I feel
Right.
that fawn
Right.
could also be something young. It's a good coping mechanism, I would say. As well
Right.
as,
But
yeah,
now looking at it, right, somehow fawn is somewhat similar to fight, right? Because both involve go to face the threat itself. But maybe
Ye-
fight is more on the aggressive side, but fawn is more on the pleasing side,
yes.
the more
I mean, if
softer,
you,
right?
yeah, I mean, if you were to look at it, there is a similarity. Then, yeah, I agree.
Mm.
It's
Right,
you
right.
actually facing the threat, but in two
Mm.
different manners.
Right, right. So fight is that maybe I'll punch my boss in the face, but fawn is that I will please him.
Yeah, I'll buy him coffee
Mm.
in the morning. I'll
Mm,
go
mm,
before
mm.
I master office. I'll buy him coffee and a
Mm.
bagel just to make
Right.
him happy. Maybe
Mm.
I'm not gonna talk about what I did wrong, but at least I'm gonna make him happy. Mm.
Right, right, right. And I think fawn is a fairly new response that is being discovered, right? Because previously it
Yeah,
was fight and flight, and then later fight, flight, and freeze.
yeah,
And now it's
yeah.
fight, flight, freeze, and fawn.
Yes.
So it just
Okay.
shows that how fear response is so common among people. And it shows that there's always an to explanation to all these responses to the
Yeah.
threat that we are facing. Okay, so
Okay.
there's a response from Liu Chua. So how do you relate the fawn response to cancer? Okay, so here is where we move on to the next thing,
Yes.
which is how do people deal with fears? Okay, so if we are go to the coping strategies, right? So these coping strategies are how people usually do. So if we are to explain the four types of responses in terms of cancer, then these are how the examples that we can use. For
Yeah.
example, fight. So let's say the scenario is that the person is being diagnosed with cancer, end-stage cancer, for example, right? So the fight response is that the person will be very eagerly or aggressively look for alternative. So like people going out for second opinions, third opinions, fourth opinion, fifth opinion. So we do have patients. I believe Umu, you have encountered such
Yeah.
patients also. They will always look for the
I'll get
answers. They
alternatives.
always look for
Yeah.
answers that they find it tolerable,
Comforting. Yeah.
comforting
Yeah.
for them. So they always
Comforting for
keep on
them.
looking for it.
Yeah.
Right. So, in another way, other than finding alternative, they'll just be in that state, and then they'll be angry, they'll be frustrated about themselves. They have temper outbursts. So these are
Yeah.
the ways that they show their responses towards their fear, the fear
Yeah.
of getting diagnosed with cancer. Right, and then
And
next going off, if on the other spectrum is flight, right? So they're moving away from the fear. So they will most probably avoid going to hospitals because they find hospital is the trigger to their fear,
yeah.
trigger to their phobia, right?
Yeah.
And
The
then they
the
might
the place,
mm,
the setting of
mm,
the hospital.
yep,
Yeah.
yep, yep, yep. So the hospital is the snake for them, right? It's a dog for them
Yeah.
because it is something that triggers their fears. So that they'll avoid going for treatments, avoid going for CT scans, because
Yeah.
knowing scan the CT scan actually brings them that result. So they will avoid going to more CT scans in the future, and of course they'll dislike talking about it. So when people ask them, so how are you doing? How are you progressing with cancer? They'll just say, yeah, I don't want to talk about it lah. And let's not talk about this. Let's talk about something else. So they are actually avoiding. So that's their flight response also.
I
Right?
agree.
So,
Yeah.
and I think these both fight and flight are very commonly seen among cancer patients, right?
Yeah, yeah. Fight
And the
and flight,
freeze and fawn
especially.
are less likely. Normally, they're more subtle. The symptoms are
Yeah, I think
less.
the freeze and four are more internal, are more
Mm, mm,
internalized. It's something that
mm,
is you
mm,
can't
mm,
actually see it in a
mm,
it externalized, so you can't actually see it. You
mm,
don't actually you don't people don't actually see it from
mm,
in their
mm,
naked
mm,
eyes,
mm. Right, right.
but you feel it. The caregivers, the cancer
Right.
patients, they actually feel that. When you freeze, you feel
Mm,
hopeless. You feel
mm,
you're the feeling of hopelessness, the feeling of helplessness, the feeling of unable to enjoy things anymore. So
mm,
those are, I think, freeze. Yeah.
And also
Okay.
they'll feel they're isolated or they isolate themselves from people.
Yeah.
So there's a
Yeah.
way that, if I don't talk to people, then people wouldn't talk. They would ask me about my
Wouldn't ask
cancer.
me exactly.
Mm,
Like if
mm, mm,
I'm just gonna withdraw myself from society
mm,
because I don't have the mental capacity to actually talk
mm,
about it, and
mm,
especially
mm,
when they have undergone treatments that could be very very tiring, that could be very
mm,
very like a bit overwhelming.
mm,
So they tend to like isolate themselves because
mm,
it's hard for them to actually talk about it and actually to explain things to other people. Yeah, and I
exactly. And then eventually
yeah,
they would give up.
eventually it will give up.
Mm,
Exactly.
mm,
Okay,
mm, mm,
and the last one would be fun.
mm,
So,
mm. So to answer Liu Chua's question, so maybe
yes.
Umu can share how does fawning comes into play
Okay,
when it comes to
so
cancer.
answering to your question is how do we relate fun response to cancer is
Mm,
actually you try to please the person that is actually taking care of you. So it could be your spouse, it could be your partner, it could be your children, it could be your parents. So you would actually do whatever you can within your
mm,
own power to actually please them, to actually
mm,
help them feel good about things. So
mm,
maybe you can try sometimes when you're tired or sometimes when you're super like overstimulated from all this treatment response. So even though
mm,
you just need time to actually recuperate, to actually relax, but knowing that your caregiver wanted something from you or
mm,
you are supposed to do something for them, you actually try to like drive yourself to actually do it
mm,
or drive
mm,
yourself
mm.
to actually talk to them. Okay.
Right, right.
And then
Another
another thing
common
would be,
thing. Yep.
oh,
Sorry,
sorry, yeah.
Umu.
No, no, it's okay. You were saying?
Okay, yeah. Another common please fawning response is that maybe the person is not ready to start treatment yet. They're still afraid of treatment, but their caregiver are pushing them to tell them, treatment is good for you. Chemotherapy is good
Yeah.
for you. You can cure, can recover from chemotherapy,
Yeah.
and the cancer patient they don't know how to react to that because they're in a state of fear. They don't
Yeah.
know what gonna happen next. But at the same
Yeah.
time, they feel that the caregiver is trying their best to provide to them, so they feel guilty, and then they try to just please
Yeah.
the caregiver. They just say,
Yeah.
"Ala, ala, okay lah, I'll just do the chemotherapy." Mm, mm,
So at the
mm,
end of the day, it will be like you're actually doing it for them. You're
mm,
actually doing the treatment for them, and it's
mm,
actually it
mm,
could be both. It could be beneficial for both sides at the end of the day.
and eventually, the cancer patient would just be dependent on their caregivers because any decision making, they'll just leave it to their caregivers to do it.
Correct. Yeah.
So these are the common coping strategies, or it can be adaptive. Adaptive meaning that it's helpful. It can be maladaptive. For
Yeah.
example, like avoid going to hospital. Those are maladaptive coping strategies. Like searching for alternatives, it can be good because the person may be thinking, okay, there may be some other ways that's more beneficial to me. So that can be an adaptive coping mechanism.
Yeah. Yeah.
So
It meaning to
so
say
these are
that
just common.
yeah,
Yep.
meaning to say that that's not it's not like a one size fit all kind of thing. It's not we're not saying fight is the best coping
Mm,
strategies or the best alternative response or trauma response
mm,
or
mm, mm,
freeze is the worst. We're not saying that. We're saying that different people undergo different response at different time.
mm,
So
mm,
meaning to say
mm,
that maybe you may fight towards a certain thing, but you may
mm,
fawn towards another thing, or
mm,
you can freeze towards a particular situation, but
mm,
in another situation you could have the stress response of flight.
mm,
So
mm,
there's no right or wrong answers, but the answer is whether it's maladaptive or
mm.
adaptive, as you mentioned
Yep,
earlier.
exactly. And again, like to emphasize what Umu said, is the spectrum of
The
fear
spectrum,
responses, the intensity of it.
correct. I agree.
Okay, right. So how can we actually do better, Umu? So if let's say we are in face of fear, for example, for cancer patients, right, when they're in face of fear, they don't know what to do, how can they do better? Maybe previously they are fawning, you're freezing towards the fear of doing cancer treatments. So how can they actually do better?
I guess to answer that question is actually to understand at the end of the day, what could be the outcome of the things. So if you feel that getting more alternatives or fighting for the alternatives will provide you a more comforting feeling, or it will provide
Mm,
you with all the necessary informations that you can get, that is
mm,
feasible for you to get, and if you
mm,
feel that at that particular moment that is the best option for you, then
mm,
talk to someone, talk to your caregiver, try to brainstorm the idea. But if you
mm,
feel that the maladaptive, you're very persistent, you're very adamant about doing the
mm,
maladaptive response, then I
mm,
believe that your caregiver and I believe that the people that care around you will try to help you in accordance to your own capacity. So,
mm, mm,
because one thing about caregivers is, and one thing as much as I understand being a caregiver myself, is that whatever that we do, the goal at the end of the day is just to provide the best for for the people that we care for.
mm,
So at the end of the day, we just have to understand what we can do to help
mm,
the people that we are caring for, and for the
mm.
patient, what we can do to actually strive or to actually go towards the thing that we want to achieve.
Exactly.
Yeah.
So what you can do better is that I like how Umu have shared. You're looking at the outcome of your responses. What does this response actually bring meaning to you?
Yeah.
If you're looking for
Mm-hmm.
alternative, if it serves a purpose for you to feel more comfortable, yes, of course you can do it. But if the intensity goes over it to the point that you are blindly looking for alternatives and then
Mm-hmm.
you still are unable to get that sense of comfort, maybe it's time to look deeper into the reason why you are doing that.
Exactly.
So this
I,
brings us to avoidance versus acceptance. Because in face of fear, right, avoidance, yeah, like searching for an alternative or not going to treatment, it can reduce your temporary suffering, it can reduce your pain, but all these are just temporary
yeah,
because cancer is
momentarily.
still in, cancer is still in you, and how much you can actually avoid, right? And what are the consequences of this avoidance?
Yeah.
Yeah, of course we don't have to suffer the side effects from chemotherapy, and I believe Umu and I we both we couldn't understand how the suffering is because we have never gone through that. So we will never experience that, and
Yeah.
of course avoiding it, yeah, you feel temporary relief, but in the long run, how does that avoidance gonna benefit you in the long run?
Mm-hmm. In the
Mm-mm.
long run,
And it,
exactly. I think that's a key
mm-mm,
point here. In the long run, how would it
yeps.
benefit you? How it gives you the advantage? Is if you were to weight it,
Mm,
if the advantages more than
mm.
disadvantages, yeah.
Right, right. And avoiding actually moves us away from values because if our value is to enjoy, the rest of our days, to enjoy the time that we have, or to even to practice our principles of survivorship, of motive self resilience. So if we are avoiding these things that bring us this sense of value, then eventually in the long run we wouldn't feel fulfilled, or we may even regret in some days in the future if we avoid. So
Yeah,
on the other hand, we
I
can
agree.
try to accept that. So that's accepting fear gives us meaning to the pain and also free ourselves from suffering.
Yeah.
So if we are to avoid it, we don't accept it, then we're still living in that fear of avoidance, that fear of fear. But
Yeah.
if we accepted that fear is a natural process, it's a common response, a survival response, right? Then we can actually find meaning in the pain and
Yeah.
find meaning in suffering as well.
You're actually acknowledging that.
Mm.
You're actually
Yep. Yep.
acknowledging that it's
Mm.
causing you pain, it's causing you
Mm.
suffering. You're actually taking that pain, you're actually like taking the pain as a whole, rather
Mm.
than understanding, or rather than seeing what, rather than, you know, talking about, pondering, ruminating about the whys and the whatnots. So you're actually
Mm.
accepting, you're actually acknowledging that
Mm.
it exists, it's there.
Mm.
And by acknowledging it, I feel that it helps with the acceptance.
Mm. Mm.
I think that without you acknowledging things, it's hard for you to actually accept things because you don't know what to
Mm.
accept. But
Yep,
actually,
yep.
when you acknowledge things, you see things as it is. You see things as the as truly as it is. It
Mm,
will make things. It will make the acceptance a bit more easy. I feel. I hope.
mm,
I hope
mm.
that it will assist the acceptance a bit more.
Yep, yep, yep. There's something what we commonly use in our therapy is acceptance and commitment therapy. So one
Yeah.
of the aspect in this approach is that we need to learn about what is known as experiential avoidance. So it means that we are avoiding the experience which is common in our daily life.
Yes. Yeah.
Experiences are bound to happen. And if we are only to avoid it, then we will be in this constant living of avoiding it all the time.
Yeah. Yeah.
And our daily life will be just thinking when is the next experience will come, when is the
Yeah.
next fear will come, and then we are
Yeah.
always in that state of fear. So it's a snowball
Con-
effect, it's a
yeah.
cycle.
It's honestly, it's a constant loop of being in a very anxious situation, just
Mm,
constantly
mm,
waiting for
mm,
things to happen. Yeah.
yep. But in another way, if we have acknowledged that fear is there for a reason, these things are what are things that are triggering to our fear, then we can make life, live together with the fear, and it can actually brings more meaning to our life. So let's say
I agree.
people, cancer patients were accepted that chemotherapy is brings in side effects. Chemotherapy is something that makes you feel fearful. Then we can live with the fear. And then we continue. We address these fears. We continue with treatment. We continue chemotherapy, and eventually we'll recover for it, or it will make more out. Can find meaning in that recovery process.
I agree. Yeah.
Without
There's a
living life with fear.
yeah, without living life with fear, that is the key point here. There's a
Yep, yep,
question
yep.
in the comment section just
Mm,
by Jason Chin Yu Ang. My mother
mm,
has been diagnosed with breast cancer, but she's in denial of it. How do I help
mm,
her accept the condition? Uh,
mm,
I guess my answers would be different, so I'll be sharing my answer first.
Sure,
So,
sure, sure.
Jason, what I would definitely recommend is to equip her with the knowledge of what breast cancer really
Mm,
is, just
mm,
to get her fully equipped by all the things that all the unknowns or all the uncertainties. So
mm,
tell her about what breast cancer is, and if she has, or what sort of breast cancer that she has. Is it occult? Is it something is it something that is seen through the MRIs or through the CT scans? Is it something that you could just explain to her what is it, and
mm,
also explain to her what could be the options out there, what could be the treatments or the alternatives that is provided to her, that is accessible to her. So by
mm,
giving her all these informations, by equipping her with all this necessary knowledge about what breast cancer really is, she is going to be able to slowly, gradually
mm, mm,
accept the fact that, okay, maybe this is something that I have to live with. But then
mm,
again, with you providing all this knowledge to her, you're actually subconsciously, in a way, you are telling her that whatever happens, I'm here for you. I'm providing you all this knowledge because
mm,
what I'm trying to tell you is I'm supporting you. I'm
mm,
going to provide all the support that I can give you. I'm going to provide all the motivation that I can give you, and that I think feels really good. Feels good to
mm,
know that actually my son is actually trying to help me. It's gathering all these informations for me. It's actually moving out of his way to actually make me
mm,
understand what breast cancer
mm.
really is.
Right.
So I
Mm,
believe that could be one of the strategies. I feel
mm.
Jefferson might have
Yep, yep.
other
Mm-mm. Yeah,
response.
I always think that knowledge is something that brings us into awareness, and is can eventually help us to accept things better. Because like in acceptance and community therapy, what we do is we increase their awareness of the present, and then we move forward from there towards acceptance. So
Yeah.
another way is that we can try to understand what's the purpose or the reason behind this denial. Is it because that she's fearful? Although we are talking about fear, right? But it makes sense, Maybe your mom can be fearful of what's going to happen next. Like how Umu have shared, right? Maybe the mom understands that you, Jason, you are somewhat important in her life, and she's afraid of losing that importance thing, the values in her life. So that's maybe why she is in denial. She couldn't accept the fact that because she's afraid what's going to happen next.
Yeah.
So other than providing knowledge, we can also look deeper of what's the purpose behind fear, and that actually moves us to our next slide, which is how we are able to manage fears. So thank you, Jason, for bringing us back here. So first is to understand. So if let's say we are using Jason's scenario, right? What I can do is help your mother to actually understand what fear is, like how Umu shared, right? Give her knowledge and awareness of what fear is, and empower that fear is actually a common reaction. Then later we start to explore the purpose behind that fear, like how I mentioned. What are things that motivates her to feel fearful.
Yeah.
And then in the end, later we learn skills on how can we move out from that state of fear. For example, we learn from past experiences and we develop self-mastery. So
Yeah.
self-mastery means that we take the past experience, then we make use of how this individual actually have the skills available in the past, that they move from that scenario or situation. Then they can learn from that. So it's a learned behavior.
Yeah,
So
I agree.
if so these are things that we can do in order to manage our fears. First is
Yeah.
to accept it, knowing that it's there for a reason,
Yeah, it's a
knowing that
survival
it's
response.
okay,
Yeah.
and then we explore the fear behind it,
Yeah.
explore into deeper. We start to peel the onion, the layers of the onion. Then
Layers
later
by layers.
yes. Then later we learn from it what we can do out of that. So that's actually promotes us to move towards our values. Okay,
Okay.
right.
All right.
Okay, so let's quickly move on to the next slide. I think we are coming to the end, right? So we have
Yes, we
discussed
are.
four things, right? We have discussed the background of fear, the purpose of it, and then what are common reactions that people have in fear, and then how we can actually do better in the face of fear. Okay, so before we end today's webinar, I just want to share about one phrase that I actually quite love from Mary Curie. So if for those audience that who don't know what Mary Curie is, oh my god, I just objectified
Who?
the honorable Mary Curie. Right, so Mary Curie is a French physicist who actually discovered radium and radioactivity.
Yeah.
So she actually brought
Mercury.
Yep. So she actually brought a lot of contribution to the field of science, right? So during her discovery process, she found out that radioactivity is actually harmful for her. But then she shared this quote: "Nothing in life is to be feared; it is only to be understood." Because she realized that if she's fearful of radioactivity, then maybe she will never discover how the significance of radioactivity is. And
Yeah.
because of that, she start to understand things behind it, understand that this fear, understand the radioactivity. So that's
Yeah.
why she able to bring so much significance in the field of science.
So
And
the fear
if we
actually
put
motivates her.
yeah, and if we put this code into our daily life, we can always know that there's nothing in life to be feared of. It's just that we need to understand what this fear means to us.
Yeah.
And by
I
understanding, it
agree.
can actually allow us to live with fear better in a more adaptive way.
In a more adaptive way. Basically just understand things better and to actually like go around it. Go around it easier. Yeah.
Yep. So if we see a dog there, this of course we are fearful, but we understand that the why we are fearful.
Yes.
We understand that right, our body is trying to protect us from
The danger.
that dog, from the
Yeah.
danger.
Yes.
Okay, right. Okay, so I think that's all from us today. So before I end, I just want to share about our NCSM's upcoming workshop. So we are gonna conduct a grief workshop open up for cancer patients who are just recently diagnosed with cancer, and of course to caregivers who have lost someone battling cancer. So because you understand that grief is so important, as similar importance with fear, grief is something significant in our daily life as well. Okay, so if for those who wish to join in our upcoming workshop, so this is a workshop that involves creative arts. So we're going to use clay to express our grief, right? So it's going to be held in 2 weeks' time. 2nd of December is a Saturday from 10 to 12 p.m. at the Resource and Wellness Center, NCSMKL. Okay, so who are interested to join, I believe our tech team is actually posting the registration link up in the comment section. So for those who are interested, you can actually register yourself through there. If you can't find the link, you can always look for us through our social media. In our Instagram, our post is up. You can actually register from there. Okay, so I think that's all, Umo. That's the wrap for our webinar today.
Thank
Mm,
you. I guess that's it.
yeah, that's it. And I think it's so good, right, that we are actually to bring
I
this
think there's
topic
another
up again.
question.
Oh, that's a question. Okay, so it's time. It's time for question. You know, we have shared so much. Of course, we have to address some questions from the floor.
Oh, okay. All
Okay,
right.
so the first question from Joanna Tan, right? It is easier said than done when others say to us, "Don't fear what you can't control in the future." However, the fear of recovery or relapse is something we fear. So how can we cope better? So Umu, so maybe you can share, how can people cope better when it comes to the fear of recovery or relapse?
Yeah.
Mm,
Okay, so the fear of recovery and relapse actually
mm,
is something quite common, actually,
mm,
especially when you have undergone a lot of like overwhelming treatments, very
mm,
painful treatments, and when you manage to, like get, you know, that clean, or you're able to like get
mm,
better,
mm,
obviously we will always have that fear of the relapse, or the fear of
mm,
not being the fear of every single thing that the tiniest bumps or the tiniest scratch could cause you to
mm,
have a lot of anxiety, and it
mm,
could cause you to have this persistent distress, and it cause you to feel a bit, to have like not good, your quality of life would tend to decrease because you just
mm,
kept on
mm,
thinking about things. So in order for you to like cope with things better, because as you said, don't fear what you can't control in the future.
mm,
Exactly, it's easier said than done. It's easier for another party, for us to actually say that it's okay.
mm,
You can't be anxious about the things you can't control. You can
mm,
only control how you respond towards things. You have to understand that it's easier for us to say because we are not in your situation, we are not in your
mm,
shoes, we can understand how it feels to be in your position. So you, and whatever that we do, we can only try to help you, to help guide you
mm,
only. But the exact feeling of to be in your position, only you sahaja yang tahu. Only you know how
mm,
it feels to be in your position. So in order for you to cope better is actually to understand, what do you need? How
mm,
do I make myself feel better about things that I can control now?
mm,
For instance, um, you like to listen to music, or music makes you feel good,
mm,
and because of the treatments you are unable to listen to much music, because sometimes when chemotherapy it's too draining,
mm,
and
yep,
radiotherapy it's too draining. So now that you have the ability to have a lot more time for yourself, explore, what is it that it feels good to be you, what is it that
mm,
makes you happy. So those are the things that I think could help you to cope better, because at the
mm,
end of the day, psychologists, doctors, your oncologists, the caregivers, we are here to help guide you through things, but no one can actually understand how it feels to be you.
mm, mm,
And
mm,
it's very, very, sometimes it's very, very overwhelming to actually tell other people that I am in so much pain, I need
mm,
help. But sometimes the words is just not there. It's hard for us to
mm,
actually tell people about what we need.
mm, mm,
So what I can say is that try to understand what you want, try to understand
mm,
what makes you happy, try
mm,
to use this time, to use this moment, to use this space to actually explore maybe your hobby, or maybe something that you're
mm,
very, very passionate about, but because of life you don't actually get the time to
mm,
actually explore it. So by all means, this is the time for you to actually understand what
mm.
makes you happy.
Right, right. Mm-mm. And to echo what Umar shared, right? Look for things that gives you meaning. If things you can't control, right? Like Umar said, do things that you can control at the present. At the same time, it gives you meaning. Because if we are just focusing on the fear, of course we will feel that the we might the relax may come to us, right? There's one day that the bomb, the ticking bomb will just explode. We'll never know,
Yeah,
right? And of course, this state of fear is valid, right? It's valid. The
exactly.
fear is valid. So what I still remember one of my clients actually shared. the exact same thing to me. So I questioned him back. So I asked him, does feeling fearful can actually stop the relapse from coming back? So feeling fearful, we are not able to stop that. If feeling fear can stop that, then we all can just feel fearful. But we can't stop the relapse from coming. If it's bound to come, then it will come. So what we can do is we channel that energy to feel fearful of things. We channel those energy to do things that we can give us meaning
I agree.
in line with our values. Because if we are
Yeah.
fearful of things, we miss so much opportunities that can give us meaning. Like
Yeah.
we are always checking on ourselves. We are going for CT scans to check whether the relapse has came back. So during this time that we have spent on checking, to feeling anxious, we have actually can use this time to bring us more meaning to our life.
Yeah.
So if for Joanna, I would suggest that look into the things that give you meaning, what you want to do at this moment.
Correct. I
Yeah,
agree.
we can't control, like you say, we can't control things in the future, but what you can control now. There are things that you can take control at this exact moment.
Yeah.
So if you would like to learn on how to cope better, I would suggest you to look at your inner self. What did you value the most? What
Yeah.
gives you meaning? Right? I hope that answered your question, Jonathan. Okay, next one. Okay, Esan is back. Okay, what's an advice from both of you for cancer patients and caregivers who are not just managing their own fear but also the other person's fear at the same time? Okay, right. So what Esan was trying to, I think, if I can rephrase it better, is that other than managing their own fear, although they are feeling fearful, maybe they have to deal with people who are channeling that fearful energy to them. Right.
Yeah. Yeah.
I'm feeling that this is the question. So how can we set things right, Omo? What do you think
Okay.
you can provide?
So, who are not just managing their fear, but also the
Mm,
other people's fear at the same time.
mm, mm, mm,
So, from what I understand from this question is that
mm,
bukan je you have to deal with your own fear, but you also have to like try to make other people feel good
mm,
about themselves. Is that it? I
mm,
think so,
mm,
right?
mm, mm,
Right.
mm,
Okay. So I guess my answer would be different people have different thresholds. Different people undergo things differently. So sometimes when people project their fear towards you, or when
mm,
people tell them their fear to you, what they need is just assurance. Actually, they just need their fear to be validated. They just need that.
mm,
Hey, look, I'm scared because of this and this and this. I'm scared because of your diagnosis. I'm scared of losing you. Maybe this
mm,
could be what the caregiver is telling the patient. So I think how you could move around with this is you actually have to validate, acknowledge that your fear is valid, your fear is true, your fear is real, and
mm,
it's okay for you to be fearful because, as we have explained earlier, it's a common response.
mm,
I'm telling you that it's okay for you to feel this way. Fear is a common response. It's motivated to be better. But I also have my own fear. The
mm,
patient can also say that I have my own fear. So
mm,
maybe we can work towards this fear together. Maybe we can talk about
mm,
this fear together. Maybe we
mm,
can understand why we are feeling this fear. What would be the
mm,
outcome of macam Jefferson cakap tadi? If we were to have this fear in a very lengthy manner, what would be the outcome of it at the end of the day?
mm,
Yeah.
Yep,
So
yep. And you also
also
understand that,
validate.
other than just validating, you also understand your capability of
Correct.
managing the fear of from your own and also
Mm-hmm.
managing the fear from others. So
Mm-hmm.
if your own fear is overwhelming to you, I would suggest you to seek other help, external help
Mm-hmm.
for that other person's fear. I'm
Yeah.
not saying that, you can, when a person tell you I'm feeling fear, you can say, no, I can't deal with your fear now. I'm feeling fearful as well.
I'm having
I'm
too
just
much
gonna
on my
push it
plate right
away.
now.
Yeah, yeah. Please don't do that, right? First validate, okay, say that, okay, yeah, your fear is valid, and I'm trying, I feel how you are feeling
Yeah.
fearful because I'm going through as well. So
But
what
I'm not
if
at the
I
capacity right now.
so what if I suggest you some other support? Like the support that we have in NCSM, we have mental professionals that are ready for you. So you can actually do that referral to people. So as much as we are human that we want to help other people, and also understand that you're capable, you have the threshold there. And going over that threshold to help people may not be adaptive for
Yeah,
you.
it will not be adaptive.
Right. And
Understand
that
your own
is a
capacity.
fawning response.
That's true. Understand your own capacity, understand your own bucket stress, and sorry, your stress bucket, understand
Mm, mm, mm,
how big it is and how much
mm,
you can only take in.
mm,
Right?
Yep, yep. Okay, so I hope that answers your question, Esan. And I think that's the very last question from us. From for us, not from us, for us.
I guess
Right,
so, yeah.
right. Okay, so how do you feel, Umu, after the very first webinar with us?
I love it. I
You
learned
love
a
it?
lot of
Okay,
things.
so
Yeah, I learned
right,
a lot of
right.
new things as well. I'm
Right,
jotting
right,
down notes
right.
actually.
Right, right. Okay, I'm actually happy that you love it because we have another one in BM, right, in Bahasa Melayu. So for those audience who wish to share this webinar for those Malay speaking audiences, your friends
Yeah,
and family,
betul
feel free
tu.
to share to them. We'll be doing that again on
Hari
Thursday, this
Khamis, kan?
Thursday. Yeah, yeah, hari
Betul.
Kamis.
Betul tu Jefferson. Saya
Right,
sangat
right.
setuju.
And Umu will be up here again. Right, right. Okay, so thank you very much for everyone for tuning in for today. I know we have extended the time a little bit, but thank you for so much for staying with us, and we'll hope to see you again.
All right. Thank you so
Okay,
much,
thank and
everyone.
yes, and thank you so much, Umu, also for coming in as a guest speaker for
No
today and
worries.
sharing your
Thank you for
information
having
for
me.
us, your knowledge for us. Right? Okay, so
All right.
everyone have a good night, have a good rest, and we'll see you again soon. Bye.